Good afternoon, everyone. My name is OOtugalu, and I am very excited to present my evidence-based practice project for Nursing 5293 Advanced Research and EBP class for the semester of fall 2025. My project title is Reducing Nurse Burnout in Acute Care Settings. Today, I would be explaining the problem of nurse burnout, summarizing the current evidence, and sharing my recommendations for practice change. My project is guided by this Picot question. The question is, in acute care RNs, how does a structured wellness program versus no structured support affect burnout and turnover over 6 months? P is registered nurses in acute care settings. I is structured burnout reduction in wellness programs. And C is no structured support system. O is decreased burnout and turnover. And T is 6 months. This Picot I have would help me in focusing my literature search and identifying effective interventions for the project. Identification of the problem, global impact. Burnout among nurses is a worldwide crisis. About 30% of nurses are affected globally by burnout. And this component includes emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Burnout doesn't just affect the nurse, it also affects the patient, and it also affects health systems. The research shows that burnout is linked to increased medication errors, patient falls, infections, and lower satisfaction scores. These outcomes highlight how well nurse well-being is directly affecting patient safety and care quality. US and local data. In the United States, burnout is even very more concerning because half of the nurses are affected by burnout, which is 50% of nurses in America. And nearly 1/3 have left bedside nursing in the last 3 years. Financially, each nurse who leaves costs a hospital it costs a hospital $40,000 to $64,500 in turnover expenses, which includes hiring, training, and temporary staffing. Locally, these trends worsen staffing shortages and increases workloads, which only fuel more burnout. That is why it's critical to look at evidence-based solution. A few days ago, one of the healthcare worker I work with we're talking about how we are not short of nurses in America, but the problem is that a lot of nurses are leaving bedside nursing because they are tired. All hospitals are always looking for nurses. They always need nurses. Why is the reason? And that is why some of these hospitals, well, not even some, but since COVID-19, about 100% of the hospitals have started hiring agency nurses and travel nurses, which makes them spend more money than they would spend when they hire a staff nurse. I'm talking about, before I talk about the review of the literature, I have the chart here for the percent of global versus US nurses that are affected by burnout. Like I said previously, 30% of nurses are affected globally and 50% are affected in the US. Now we're going to talk about review of the literature, evidence level. To answer the Picot question I have for this project, I conducted a structured literature review. I found 10 high-quality studies. 3 are level 1 studies, which is systematic reviews and meta-analysis with strong overall evidence. 2 are level 2 randomized controlled trials testing wellness programs. And I had 2 level 3 quasi-experimental studies showing program benefits and several cross-sectional studies that explain prevalence and risk factors. Together, these studies provide a moderate to strong evidence base supporting intervention. Pros and cons of the literatures. This research has clear strengths and weaknesses. On the positive side, meta-analysis and RCTs show that mindfulness, resilience training, and cognitive behavioral interventions reduce burnout symptoms and improve emotional well-being. Organizational changes like better staffing ratios and leadership support also help. On the other hand, some studies are cross-sectional, which means they can't prove cause and effects, and there is variation in program design and outcomes measured, making the comparison very difficult and challenging. This is the chart for the amount it would cost hospitals to get new nurses and hire them, from $40,000 to $65,000. Review of the literature, synthesis, and themes. When synthesizing the studies, 4 key themes emerge. The first one is staffing and workload factors, which is high patient load and long shift, and which these 2 things increase nurse burnout. The second one is interventions, which is mindfulness, CBT, and organization change. This support shows promise. The third one is prevalence and risk factors across units and regions. Burnout is common, like I said, globally and in the US, especially in acute care. The fourth one is shift work, sleep disruption, and mental health. These themes show that solutions need to address both personal resilience and system-level change. Recommendations. Based on this evidence, I recommend implementing a structured burnout reduction and wellness program. This program should combine mindfulness-based stress reduction and resilience training, cognitive behavioral tools to manage stress, and organizational strategies such as safe staffing ratios, protected break time, and leadership support. By targeting both the individual and the system, we can make a sustainable change. Evaluation plan. To measure success, we need a clear evaluation plan. Use Maslach burnout inventory, which is MBI, to assess burnout before the program, right after the program, and at 6 to 12 months. Track turnover rates and absenteeism to see if retention improves. Also, monitor patient safety outcomes such as errors and falls to connect nurse well-being with care quality. Having objective, measurable data is essential to prove the program's value. Suggestions for further study. Even with solid evidence, there are still gaps. Future research should involve using long-term randomized controlled trials to test program sustainability. The cost effectiveness of wellness programs should also be examined. And leadership and culture-based intervention should also be investigated too. The impact of leadership and organizational structure on burnout should be studied, and hybrid models that combine individual wellness with structural change should be explored. In conclusion, nurse burnout is a widespread and costly issue that affects patient safety, quality of care, and the financial health of healthcare systems. The evidence strongly supports structured wellness and staffing interventions as an effective solution. By implementing these programs, hospitals can protect nurses, they can improve patient outcomes, and they can create healthier, more sustainable work environment. This is the end of my project, and this last two slides are showing the references I used during my research. Thank you very much. Do you have any questions?